Separation anxiety disorder (SAD) is a psychological condition in which an individual experiences excessive anxiety regarding separation from home or from people to whom the individual has a strong emotional attachment.
The problem with some of the parents in dealing with separation anxiety that go in the management of their kids from their own thinking. They don't go to the safe references and go and treat their kids. They're looking for their neighbors, asking their friends, then go and deal with their kids. Separation anxiety is a psychiatric disorder, should be treated. Drugs sometimes, behavioral therapy or behavioral management is very important, and we don't want the parents in dealing with their kids, they go from the way they are thinking. If you become very aggressive with the child, he will not be fearful, he will be a strong man. If you come very nice with him, he will come very quiet person. No. There is a specific steps we are discussing in this program which make both of you as a mother and a father can deal with your child.
Separation anxiety is some sort of an anxiety disorder. Patient who's suffering from separation and anxiety has a problem when he separates to his parent. We can find some children suffering from separation and anxiety, especially during the sleep period, that the patient started to cry, started to make a very noise if he cannot see his mother beside him on the bed. In addition to, children who are suffering from separation and anxiety may induce some sort of social phobia and cannot communicate with people around him. And very clear important point that when you found patient or child who is suffering from separation and anxiety, you may observe his anxiety degree and all his anxiety symptoms when he get into his school at the first day. He cannot able to separate from his mother. He catch and holding his mother's hand by all his effort and by all his strength. He cannot able to continue the classroom during the all school days.
Separation and anxiety disorder, it is a well-known disorder. We regard the main etiology for this disorder, what is called psychosocial factors, and the temperament react with other psychosocial factors, make a child unusually shy, withdraw from unfamiliar position and persons. We must also respect that about 1/3 of cases have a heavy load of hereditary factors. Also, we must consider that some mothers which are anxious carry the genetics, and also affecting environmentally the rearing of the child in the same way of becoming shy and anxious. So genetics and environment play a major role in making this disorder.
The normal attachment is defined as a strong emotional bond between the children, or that exists between the children and their caregiver. Disorder of attachment are considered to be a disruption of the normal attachment, and this may include the anxious, the avoidant, or the reactive type of attachment. Such kind of impairment cause significant distress for the children as well as for their caregiver. For selective mutism, it's refusal to speak in certain social circumstances or under in certain places. Such refusal to speak will be reversed in other situations.
Separation anxiety, we can define it as universal human developmental phenomena that's emerging in the infant less than 1 year of age, and marking the awareness of separation from his mother or the caregiver. It means that separation anxiety, it is a healthy phenomenon. The infant can realize that the surrounder are either the caregiver or the stranger. So there is a normative separation anxiety peaks between 9 months to 18 months and diminishes usually 2.5 years of age.
As regard epidemiology, we must know that there is normal separation anxiety period in the life of every person, which begin at 11 months of age up to 1.5 months of age and end after 2.5 years of age. We must also know about transient separation anxiety disorders, which affect about 15% of youngs, which normally appear with unfamiliar situations and unfamiliar persons. But we have about 2.4% of preschooler age, which increase or go to peak at age of 4, at the beginning of school, reaching about 4% of children at the schooler age, and go down to about 1.6% of adults have a separation anxiety disorder.